The point where we move on to the next area, show and tell. I welcome the moderator of the session, Alex, on stage, please. And I believe you have a lot of really interesting use cases. The only thing I ask you, we have a little bit of delay in everything that you've done today. We will try to skip any technical issues. So if there's anything, you just move on. I will not delay anything just because the sound is not on, okay? That's not the time for today, okay? Thank you so much, and looking forward to have the show and tell. Alex, the floor is yours.
Thank you very much. So after this executive order, as the summit's slogan says, the impact of AI on the insurance value chain. Let's have a look on some of those solutions, and let's switch gears. This morning we've seen lots of proposals of solutions for the market. Throughout the next couple of hours, more or less, we would like to have a look on solutions that has already been implemented, which is the next stage of maturity phase. And let's start with a local use case. Let's please welcome on stage Samir from QIC and Wayaf from WellX. Hi guys. Let's have a look at well-being platform who has been implemented and the experience of you guys that have been doing that. You can just start with the slides or you start with the introduction, guys. So who had the initial idea?
So WellX was founded 2 years ago, and we've had a nice little love affair with QIC and Mena Insurtech. We came here with just an idea, and somehow we managed to end up with a really long-term partnership. So very excited about it.
Okay, Shamir, what was your first proposals they made, and how was what are your first thinkings of the market fit of the solution?
So basically, when I came to UAE first, so because I was in a different country, I just joined QIC last year. So I was just looking at what are the innovative solutions that can cater to the market. So UAE market is overcrowded with insurers with a lot of products. So eating into the same share of the pie of the same cake, I thought that's not the right thing to do it. So we need to show what we are what we are going to bring into the market. And definitely wellness, I mean, everybody in the insurance industry, health insurance especially, they all know that wellness is the next thing. So basically that was a time when we started interacting with the WellX team, and definitely they also told me that they were the winner of the QIC, the same program, which unfortunately I was not a part of it at that point of time. But then when we started discussing on this, we definitely thought, yes, this is something which we also want to be a part of it, right? So as an insurer, and why should I leave that benefit to others? So I should capitalize on that, and that is where all this love story began, I would say.
So would you just introduce the solution to us and try to make us understand how you implemented it and operationalized it within the organization?
Absolutely. So I think the slides are a bit wonky, but let me just, we have this here, so we can look at that. The idea of WellX was to use well-being and digital health as a way of engaging customers for health insurance companies, rewarding them for healthy behaviors, and rewarding them for using digital health tools that cost less than when they walk into a doctor. The challenge that most members face is either the insurance provider will give them 4 or 5 different apps to use, which are very difficult to download. They don't really have a very good relationship with their insurance company. And the way the region's insurance infrastructure is structured, people have mandatory health insurance. And so they're like a credit card for every provider that they walk into. So we need to sort of change that, either get people healthier or get them to use digital health tools. We combine everything into one solution. So we leverage gamification, points and rewards, and access to low-cost tools within one platform, and then provide that as part of health insurance.
Okay. How did you start? How did you convince the organization and the people involved in the implementation of the first use case?
So we failed multiple times.
That's good.
Yeah. The first time we went with the D2C insurance product, that was very difficult to sell. Then we went B2B, again, directly selling to companies. Then we launched our SaaS solution, which did start to get traction, which is when we approached Samir. But at that time, Samir said, well, we are growing very quickly, and I don't necessarily have the time to try to bring in this solution within our strategy. And he had a good suggestion on how we can take this forward instead.
You as an executive vice chairman of for life and the health part, and coming from the outside, that's a good kickstart, right, to do something different.
Absolutely true. See, basically, I mean, as I told again, now everybody has got this information, right? I mean, health insurance, when you really look at the data, you have enormous data available. Like, you have especially a market like UAE where compulsory medical insurance is in picture. Regulator also provide you with a lot of information. But at the end of the day, what you do with this data, that was the key thing. Most of the insurers, including ourselves, what we were doing is we were only doing a post-mortem of this data. So basically we wait till the 9th month or 10th month when the renewal happens. So that is where we realize that, okay, now these are the things where things have gone wrong. At that point of time, you are already settled a claim. You have already incurred that claim. You cannot do anything on the corrective measures. So that is where, I mean, when we discussed, we had a lot of discussions and we said that, see, listen, if you are able to do the corrective mechanism at the 3rd month or 4th month, or you can do a lot of predictive analysis where the scheme is going to end up. So that is where we thought that data, if you are able to do it, how we can get that information. So that is, again, a part of thing come from the wellness activities, what they do. They capture a lot of information. Those data, if you can bring it into your predictive analysis of your claims, how we are going to end up with. So that is where we developed this product, and that's what it's going wonders now for that particular portfolio.
And I think one of the key things to note is that it's very difficult to sell to an insurance company as a startup. Like, they're very large organizations. It takes a long time. It's a very long sales cycle. And in fact, how we ended up partnering together, we haven't cost QIC a dime. In fact, we've made them millions already. And that's because we worked together to create a new product that launched and that generates revenue for them from day one. And slowly, with the new product, we're getting the data and insights we need that we can then apply to the rest of the portfolio. And so this has been the strategy that we went forward, where it's sort of mutually beneficial to all parties with a long-term vision, but doesn't cost anything. The sales cycle really wasn't there because we co-created a product. And I think from an insurance perspective, it makes a lot more sense to have an insurance product that flexes with the data from day one, see how that works within a segment. Clearly working very well. We've done $7 million of premium within the first 8 months of launch. So sort of going very well. But yeah, Samir, any thoughts on that?
Yeah, because we didn't want to disrupt the existing platform, right? See, we had roughly around 200,000 lives already insured or 150,000 lives already insured. So when you're coming up and doing anything on that existing portfolio, maybe there can be a disruption. So what we were trying to do is we created this new product as a pilot project. So whatever the things we are learning out of this, we can easily replicate into the other portfolio. So that is where the test case of this particular product was launched. Ultimate intention is, yes, to use these learnings into the entire portfolio, which is again a full-fledged AI development thing, what we are trying to do. But with this test case, it's always easy to come up with a small trial base, right? So that is what we have done, and it is running really well for us now.
It's always wonderful to see use cases that within the first year generate that kind of positive impact, right? Vaibhav, if you look back at the slides of the last year when you guys won the competition, right? And everything that was attached to it, and you compare it to the outcome of this year and everything that and everything, all the effort you've put into it, what would be the main recommendation to those guys who has just presented that are in the pre-maturity phase of yourself? What is the recommendation for you to those guys? What should they do to obtain similar results?
Thank you. It's quite interesting. So I think we have to have the vision. The end goal has always been the same. So we set out to make the nation healthier, bring down healthcare costs at a national level, and we believe that through the payer that is possible because that's one financing all of healthcare, especially in the region. But like I said at the beginning, we failed at so many attempts of making that happen. The go-to-market changes, the way the tech work changes. So I think flexibility in how you get there is extremely important, as long as you maintain the vision of the end goal. And then finally, aligning yourself to the same incentives. Within the insurance value chain, everybody has different incentives. The payer has a different incentive to the consumer, to the provider. But in this case, we were successfully able to marry the incentives of QIC and ourselves. End goal is to bring down the claims, everyone agrees, but how we get there without the administrative hurdles of changing a very, very large corporation, that's really work. So really find a way to align yourselves. I think that's what's going to work.
Okay. Just by the way, if some of you guys have questions on the use case, just raise your hand and throw them in. What is your perception, or how did your perception change of interacting and collaborating with startups due to the positive impact of this use case?
See, definitely, I see a very positive change in the way they think being a startup, because traditionally the insurance business, finance industry, we all think in a normal routine way, right? So we have been having a set practices in place. So sometimes you always tend to go by what is the existing practices, and you do a lot of, lethargic you will become, right? So that is where your innovative setups like a startup will bring into your table, saying that, see, listen, this is the way you are doing the things. Now approach this in a different way. So that can be in terms of underwriting, in terms of claims, in terms of behavioral studies. I mean, it can be anything. And that also, and in the current market, what you see is you cannot have a fixed strategy, right? Saying that, okay, in the beginning of the year, we decide that, okay, this is what I'm going to do for the next 12 months. No, my experience is you have to keep changing your strategies as the market evolves. So probably suddenly, because you have seen all of a sudden 2 years back, a COVID came, you cannot have the same strategy what you have decided in a 5-year plan in 2020 or 2018, right? So you have got the changes, what is happening, but you have to keep evolving the strategies, and which with the help of these kind of startups, innovative thinking, AI, even AI has evolved quite a lot. So probably when we start discussing, we were able to do some achievements, and today we are seeing there are even a lot of new things coming up. So how fast you adopt to those changes and you try to bring it in your portfolio, you will be saved, right? Because the more the volumes you handle, even a small penny saved, that is going to add up your profitability.
Yeah.
So that's as simple as it is.
So startups bring in business ideas, bring in talents, bring in flexibility.
100%. That's my experience.
Okay.
Yeah, I mean, I think for us, as we move forward, the idea is that we can work together to actually stitch all the data that Samir was talking about. The insurers have the data, people have data on their devices, the providers have data, but can we bring that all together? And that's when the AI piece comes in. Today, we use AI as a customer service tool, so members can ask questions about their insurance policy. But then the same model, with access to the right data set, can start to give the right recommendations to each individual. And now, I mean, we're tying that in, which is sort of, I don't think anybody else right now in the region has that comprehensive access. So as we build that up, it's going to start to drive, much better results, and we can bring those claims down using all the biomarkers and sort of real-time data that we have, and make the interventions much earlier in the journey, which is quite exciting. I think we can make people healthier. That's going to be great.
One specific question that I see many times when we bring together Insurtechs and carriers, due to the fact that you throw them into a room and you make them study and reason about one specific use case, from that emerges other use cases and other applications, right, of initial ideas. Is that something that you stress in a systemic way in this collaboration?
So we have started this with our SME segment, which is very easy to handle. So because the number of people insured under the single group is relatively low. So we have started our test case with that SME, and as we all know that it's only a tip of the iceberg, right? You have a lot of population, the large corporates, individuals. So those kind of things are still lying under the water. So the plan is whatever the learnings we have done over this last 6-7 months, we need to now start establishing into the other segments as well. So that is where you keep again evolving. Maybe you are going to see a different set of problems when we start getting into that. So, and you keep learning. So that is where, and the idea or the very good thing what is happening with AI is your learning curve is relatively smoother and faster, I would say. Manually, physically, when you are doing this, probably it will take 1 year for you to learn. With the help of AI, with the kind of the technology development what has happened, you will be able to develop or identify that in 1 month's time. So this is what going to help you as an insurance provider, because ultimately we are paying the claims, right? We are pricing the policy, and 1 year we have to run with that price. So there is any changes on the premium, on the claims, that is going to reflect in this.
What is your experiences with the carriers simulating new ideas within the process and the flexibility of mental flexibility of thinking about other applications and use cases?
I mean, we obviously always want to run at 1,000 miles an hour. Carriers have, a slower pace, but as long as they're willing to experiment and work with us, I think, we do get to the results. And it's been 2 years in, and we've been able to partner with multiple carriers, but this is sort of the, culmination of all the efforts in different phases. Our plan is to become the biggest, baddest with QIC and really change the way insurance is experienced. Because we truly believe that the cost of insurance is becoming prohibitive, and that's a result of the way the product is structured and the way people behave. And so we need to change that. And clearly, we're seeing some results early on in terms of lower losses, but this will grow and we'll learn and we'll improve over time and make these guys significantly more profitable.
Vairav and Shamir, we're going to have you back on the 3rd edition of this conference next year, and you're going to tell us the next maturity phase you're going through. So thanks very much for being here.
Thanks a
Have a
lot.
good afternoon.
Thank you. Bye-bye.